Hello and welcome to For Your Health, a program that helps you to stay healthy and informed. I'm Mark Crosby of Quincy Access Television. Joining me, as in programs past, is Caitlin Pico. She is a public health nurse here in the city of Quincy. So welcome, Caitlin. It's great to have you back for yet another program.
Yes, thank you for having me, of course.
And we do want to send a shout out to Dave and Jerry Pico, who we understand watch the program.
Yes, Mom and Dad, they're very proud. They love it.
And absolutely they should be. A lot of great information that you provide, not only to them, but to folks in Massachusetts and beyond.
Yes, very expanded these days.
Yeah, and that's great because you do such a great job. So thank you. Today, I thought this topic you and I were kind of tossing around in a previous show. This would probably make a great topic. That was the thought, and this is the time of year to do it, and we will be talking about recreational summer camps.
Yes, so a big part of what we do at the local Board of Health in the nursing division in Quincy, we are responsible for licensing recreational summer camps. So there's quite a lot that goes into it. So I tried to do my briefest overview of information, but as we go into the episode, we'll educate on where to find additional information if needed.
And we should also mention that obviously this is Quincy, Massachusetts, but this program does play across the country. So folks, if they're seeking additional or specific information, they should get in touch with their local or state government.
Yes, these guidelines are specific to Massachusetts. So all throughout Massachusetts, their local Board of Health would be enforcing these guidelines. As you say, it could be different in other states. So definitely check in with your local Board of Health if you want to operate a camp or send your child to a camp and you have questions. Your local Board of Health is a great resource to reach out to.
Very good. And I think as we normally do, let's look at the outline for today.
Yeah.
We will be talking about, I guess we will start with a definition of a licensed recreational camp. We will talk about the purpose of Massachusetts Department of Public Health regulations, camp staff requirements, staff to camper ratios, healthcare requirements, local Board of Health inspections, and where to find additional information on camps. So quite a bit of information to cover, and we have a half hour to do so. So let's get right into it. The definition of a licensed recreational camp.
So a licensed recreational camp is any day or residential program that operates between June 1st and September 30th. That serves 5 or more children that are not from the same family or are personal guests of the program operator. So it's important to know that not all summer programs for children are actually licensed as recreational camps. There are some exemptions. But there are certain factors such as the number of children participating, the length of the program, in the entity operating the program that determines whether they need a license or not. So I always say, when in doubt, if you don't know if your program qualifies, reach out to that local Board of Health because it is a lot of work that goes into operating a camp. But it's all to keep the safety and well-being of the campers and the staff. But there are some of those exemption programs, for example, like summer schools that are licensed by the Department of Education. They would not be licensed by the local Board of Health. And there are some certain clinics, if they're drop-in clinics, you might be exempt. But when in doubt, check in with that local Board of Health because they can give you a clear definition on whether you need to go forward and actually license your program.
I guess when we talk definition, and you and I discussed this a little bit, you can't necessarily call everything a camp. If you call it a camp, it falls under certain requirements. You could call it possibly a workshop or a clinic, which again fall under different guidelines.
Yes, because especially like there are some workshops, like if it's a classroom-based workshop with no high-risk activities, like there's no swimming, no obstacle courses, all of that, they may fall under an exemption, but they're not allowed to call themselves a camp. So I've had to make several calls since I've been in the department just saying, you're okay, it's not an issue, you just cannot say recreational summer camp in the title.
Right. Let's look at the purpose of regulations.
Yeah, so the state regulations that are enforced for summer camps, it actually falls under, it's 105 CMR 430. And these are minimum standards for recreational camps for children, and it's under the state sanitary code. So these are state mandated, so people can't, you have to go by the book. If you are a camp, you have to do everything that's required. And of course, the local Board of Health, that's when we come in. We're the ones going through that paperwork and making sure you have everything and it's safe for you to operate. And these regulations, they establish a minimum health, safety, sanitary, and housing standard to protect the well-being of the children that are in the care of the program. So for example, like these regulations, they require background checks, both CORI and SORI for their staff or volunteers if they have them.
Okay, Corey I knew, but I didn't know the other one.
SORI would be like a history of like sexual offenses, basically. So it's criminal offenses and sexual offenses.
Okay.
So the program directors have to submit all of their staff to both CORI and SORI through the state. And we just make sure that they submitted the names. We don't necessarily go through the information, but as long as they're done and if somebody was flagged, they wouldn't have them work there, of course. But these regulations, they also they require proof of immunization for the children and the staff. And they also require proof of appropriate training and certification for the staff, especially when they're conducting high-risk activities. And again, that was the swimming, horseback riding, all of that. I shouldn't say luckily, but in the city of Quincy, the biggest thing we deal with, we have some pretty big camps, but swimming is our biggest thing that we kind of look into. And again, it's all for the well-being of the children. Some of those other protocols, there's kind of too many to list out in a half an hour. But just for example, there's abuse and neglect policies, discipline policies, emergency plans for natural disasters, fire evacuation. They need to make sure they're checking in with the fire department to make sure their site is checked. They have an evacuation plan and their staff and campers know what to do. So there's a lot that goes into it, and it's very important to know that all of these, if you are sending your child to a recreational licensed camp, it's nice to know that you do have somebody checking into all this information to keep your child safe.
Absolutely, because those are your children. You, of course,
Yes.
want them to have a great time. You want them to be safe.
Absolutely. So it's very important, and we take it, and we're very lucky. We have 10 camps here in the city of Quincy that will be operating this upcoming season. And all of our camp directors and their staff, they're amazing, and they work really hard.
You mentioned staff, and that brings us to some staff requirements.
Yes, so each camp, so I'm gonna, for this episode, kind of lean towards day camps, because that's what I deal with in the city of Quincy. If it's residential camps or trip camps, it can be a little different. So again, you would want to look further into the state regulations. But for a day camp, the director has to be at least 21 years old, and they have to provide evidence of at least 2 years of working at a summer camp experience. Or if they don't have that experience, they have to complete a camping administration course. And that just kind of makes sure they're well aware of how to operate the day-to-day of a camp. And then if it was a trip camp, for example, our DARE camp, which is run by the Quincy Police here in Quincy, they do have a lot of field trips. So their directors have to be at least 21 years old. And we're very lucky because they're all police officers, all of their staff.
21 or 25?
For if it's a trip camp, if they're going to go on field trips, the director has to be 25
Okay.
or older. And then for counselors, so for these day camps, if it's not a sports camp, then the counselor has to be at least 16 years old. You may have a junior counselor that can be 15. And they kind of just work along with the older counselors. If it is sports related, we have a lot of basketball and volleyball camps here. Those counselors have to be 18 or older, or they have to have graduated high school. And when these camps hire their staff, their counselors, they have to make sure that each counselor has at least 4 weeks experience as a junior counselor, or working in a structured group camp setting, or at least 4 weeks supervising children. They also must complete a camp orientation and training, so that's making sure they're aware of all the policies in place that camp has. And for example, if it was a sports camp, one thing that those counselors are required are heads-up training, which is concussion training provided by the CDC. So there's a lot that goes into it to make sure that these individuals that will be supervising your children are adequately trained and they know what to do in case of an emergency. And one other important thing is the youngest, so there has to be at least a 3-year age difference between the youngest counselor and the oldest camper. So you have to make sure they're at least 3 years older in order to be working with those children.
And of course, it must help with that range, or that, that range that I guess the camp director, the counselor, would have some authority over the campers as well.
Yes. And when actually going into the next, so we have the staff to camper ratio. So it's very important for our residential day or sports camps. If the campers are 7 years old and older, there has to be 1 counselor for every 10 campers. But if they're 6 years old and younger, that group would need 1 counselor for every 5 campers. And this is kind of, in even just doing my camp inspections, they're so good at what they do, and they do checks, they have buddy systems, so they really make sure everyone's accounted for and everybody's safe at all times.
And we should mention that a lot of, during this time period, during the spring and during the summer, there are a lot of inspections that go on that do involve the Quincy Health Department in this case, but I'm sure throughout the country, the health department that I suppose oversees that region.
Yes, so definitely besides summer camps, we do a ton more inspections as well. But for summer camps, granted the season's June 1st through September 30th. If it's a brand new camp, I recommend reaching out at least 3 months prior to your start date to get everything in order. But we require, well, I'll get a little bit into it a little later, but we require our camps submit everything by May, the end of May, and then 2 weeks before their camp starts, they have to start submitting their medical records and all of that. So it's not an easy process, but we're very lucky to deal with the camps that we do have.
Well, and as you're telling me all this, I'm thinking to myself, yes, it seems like a lot, but that's good because the adults can feel like their children are being cared for and taken well care of.
Yes, and they think the state guidelines, regulations, I should say, that are implemented in camps, they think of everything. They think of traffic control. They think of if a camper's missing. So that way, no matter the situation that's at hand, they know who to call. They also, in their protocols, are required to have all first responders, so the local hospital, the local ambulance, their local police station. So it's very good to protect your child and knowing they're safe while they're in the care of the program.
As we're talking about this tomorrow, as a matter of fact, my 19-year-old son is going to lifeguard training for the YMCA
Amazing.
close to us.
Oh, amazing.
So he'll be supervising, I'm sure, camps, summer
Yeah,
camps.
he will probably find himself in summer camps because I know our YMCA, they utilize their own lifeguards on hand, of course, when they do allow their swimmers, their campers to swim.
Right.
Yeah.
Let's talk about healthcare requirements.
Yeah, so a very important part of summer camps is the healthcare aspect. So each camp requires a healthcare consultant. So this is either, it's a Massachusetts licensed physician, a certified nurse practitioner, or a physician's assistant with documented pediatric training. And so this individual is, they have quite a few responsibilities. So they assist with developing the healthcare policies, and they review these annually to make sure nothing needs to be updated. They have to be available at all times during camp hours for consultation if they needed to be reached, or they can provide professional coverage if they're not available that day. They develop and sign written orders that are given to the camp healthcare supervisors. I'll mention what their role is. And the healthcare consultant also has to acknowledge the medications on site. And then they review, approve, and provide training for the healthcare supervisors and the other staff. So this would be general first aid and oral or topical prescription medications, EpiPen use, and diabetic plan management and insulin use. So basically, any camper that's going to the camp, they have to submit their health record, and they need a physical within the last 18 months. And then the camp gets that information, we review it. If there is an EpiPen or an inhaler, we have some children that might take, say, for example, like Ritalin. We make sure if that is on their previous physical, we make sure that the parent signs a form to authorize the camp to administer those medications. And there's also protocols on how to store the medication, but they're trained just as like a nurse would be trained, like right person, right dose, right route. So it's a lot goes into it. And the healthcare consultant, they also sign a healthcare consultant agreement form. So that agreement form, when the camp submits their application in May, they need that healthcare form because without the healthcare consultant, you cannot operate a camp.
Were we going back to the healthcare supervisors?
Supervisors. So for the supervisors, what they do, I apologize, I don't have, so a supervisor, they can be nurses or athletic trainers, or if that's not available, like the majority of our camps will have their healthcare consultant, a doctor or a nurse practitioner, and then their supervisors would be, they have to be 18 years old or older. They have to be first aid and CPR trained, and those have to be current certifications, of course, so we check those each year. And the supervisors, they have to be on site at all times. That's why, depending on the size of the camp, you might need more than one person. You want a substitute person at least, so that way if you wake up sick and you can't go, if the healthcare supervisor is not on site, the camp can't operate.
Right.
So that's kind of where the local board of health comes in. We go out and we inspect to make sure they are there. They have the medications in the right containers and all of that. But their role is very important because they're the ones actually working with the children and assessing their medical needs and all of that.
How come your workspace looks so much better than mine? In every show, I have so many papers and different sizes, I think, a different size type. That, of course, is because of my eyes. But yeah, you
Well,
have
if it
such a
helps,
neat space.
I think I went out of order, if that helps at all. So.
Nothing helps me. Let's talk, we did touch upon this, or at least I did touch upon this, the local Board of Health inspections.
Yeah, so I feel I kind of mentioned this here and there as I've been speaking, but I just want to stress, if you're looking to begin a new program, reach out to your local Board of Health at least like 3 months in advance, because there's a lot of information. Along with all of these protocols, there's a bunch of paperwork that needs to be signed off to confirm the trainings, the orientation, and all of that. But the health department is required, so again, we require this application, the promotional literature for the program, along with that healthcare agreement form to be submitted by May. And then 2 weeks before the camp opens, we have the camp directors submit all of the staff records and as much as the camper records as possible. We understand it's hard, because especially when we had the pandemic, it was tough to get kids into doctors. So like it was all kind of fallen back, and parents work and they're busy. But it's very important, if your child doesn't have a recent physical within the last 18 months, they can't go to camp. And if they show up to camp and they're supposed to have an EpiPen, but they don't have the EpiPen, they cannot be there. Also, if they have the EpiPen, but they don't have the medication, the authorization form, which is a big thing we run into, because it can be overlooked. And a lot of times these children don't use these inhalers or these EpiPens. But it's very important to stress, if it's written on their physical, they need it unless they have a doctor's notes saying otherwise. So that's kind of what we do. And then every week that the camp operates, the local Board of Health does at least one inspection. So during those inspections, we'll kind of follow up, like if a camper didn't have their physical, but they're there this day, we'll make sure the physical's there. And our biggest thing, we go around and we check every backpack of the staff to make sure every medication that needs to be on site is on site. And then at the end of each camp season, so the inspection form that we fill out is a state form, because of course there's state regulations. So we keep those on record in the health department. If we got audited, of course the state can request those records at any time. So we would have to submit all the records to prove that we went and we licensed the camp and we inspected it. And at the end of each season in September, I have to send a report to the state health department that gives information on every camp that operated, the directors, the capacity of children, and all of that. So there's a lot that goes into it. But again, it's a lot of hard work, and I commend these camp directors that do the work, because they are really going above and beyond to make sure that your child has a great time, but is also safe while doing so.
There's a lot, you said it, there's a lot of moving parts here, and a lot of checks and balances, which again should provide comfort for parents.
Yes, and it's important to know that if a parent at any time, if they want a copy of the policies and regulations of that specific camp, they can request those either through the camp or the local Board of Health. We would have those on file. So it's important to know you do have rights. If you wanted additional information, because of course I know I rattled through a bunch of different policies and all of that. If you wanted specifics on the state regulations, you can go right to mass.gov. If you look up recreational summer camps, mass.gov, I believe it's the second link that pops up on Google, and it has all of the forms that are required, everything that needs to be signed. So there's a lot of information out there, and if you're a parent considering sending your daughter or son to camp, definitely take a look and do your research, because you want to make sure they are licensed to have a little peace of mind that they're going to a safe program.
And again, we spoke, which makes sense totally, about Massachusetts. But if someone is watching this program in another state, and we know that they do, again, get in touch with that state's Board of Health.
Yes, the local Board of Health would be the best one to reach out to. They might refer you somewhere else. It could operate a little bit differently in another state, but the local Board of Health is a good point to start at, and they'll refer you where to go from there.
Very good. Well, thank you for coming in at the beginning of camp season. You had mentioned June 1st, and June 1st is today.
Yes.
So perfect timing for this program. A lot of great information, and Caitlin, you do a great job every time you come into the studio, so thank you.
Thank you so much for having me.
You're welcome. And thank you at home for watching, and please remember, no matter where you live, to support your local access television station for programs just like this.